free COVID-19 vaccine. Why people living in Arizona will not have to pay for it once it's approved.
Plus, recreational marijuana is officially legal in our state, but don't head to the dispensary just yet. Your questions answered ahead.
And on Break It Down, the difficulties that come with changing careers.
Cronkite News starts now.
Good evening and welcome to Cronkite News on Arizona PBS. I'm Rosara Wordsworth.
And I'm Harry Croden. Thank you for joining us.
Coronavirus cases in Arizona continue to climb. This morning, health officials reported 5,442 new cases. That's the second highest ever, with 82 additional deaths. And nearly 100,000 Americans are now hospitalized, an all-time high. The good news, an FDA panel meets December 10th, and U.S. authorization for a vaccine could come within days of that. First in line for the limited supply, medical personnel and residents of long-term care facilities. A CDC advisory panel just made that call. As for Arizona residents, we will not have to pay out of pocket to receive the coronavirus vaccine. Yesterday, Governor Doug Ducey issued an executive order stating, once approved, it will be made available at no cost.
I'm issuing an executive order in cooperation with our insurers and our healthcare providers that ensures every Arizonan can get a vaccine free of charge.
The CDC is reiterating the guidance it gave for Thanksgiving. For Christmas, don't travel. If you do come in contact with a person who has the virus, your recommended quarantine time is now 10 days instead of 14. If you test negative, that time is reduced to 7 days.
After a city council meeting yesterday, sports fields and parks will be shut down across Phoenix due to the surge of COVID cases across Arizona. The 7-2 city council vote puts a stop to sports tournaments, essentially canceling 30 major events between now and the end of February. There was debate during the meeting, but ultimately the city council found that public sporting venues are too much of a risk.
This is one of those things that shouldn't be political. We should be trusting science. We should be trusting the numbers and trying to protect each other during this pandemic.
Meanwhile, the Arizona Soccer Association says some of their tournaments will be affected more than others. Not all of their clubs use City of Phoenix fields. They expect to work with neighboring cities to reschedule some of the events. CEO Rick Kelsey says he respects the council's decision, but wants to work with city officials to come up with a better resolution.
Instead of just saying kids can't play, how do we understand what the solutions are so that we can ensure kids can play? Because we all recognize, and even the state superintendent acknowledged, the emotional impact on children right now is immense. And instead of looking for the solutions, we're just told we're the problem, but we're not being included in the conversation.
The shutdown affects at least one major tournament this weekend. The Salvation Army Christmas Angel Soccer Tournament is now canceled. Last year, the event drew more than 200 teams. Organizers are still planning to hold the toy drive that coincides with the event.
Many schools in Arizona have moved back to virtual learning, but that's not the case for Maricopa County's largest district, as Taylor Tasler-Oatley reports.
A letter sent over the weekend from the Mesa Education Association calls for Mesa Public Schools Superintendent Dr. Andy Forlois to move the district from in-person learning to virtual by December 1st. As of December 2nd, the school district is still in person. Currently, the percent positivity in Mesa Unified School District is 12.9%, with almost 300 cases per 100,000 people. This makes them one of the highest in the East Valley. The recommended learning method for the Mesa School District is virtual learning, since they are currently in the red in 2 metrics out of 3, according to the County Health Dashboard. Joshua Buckley, the president of the MEA, feels the metrics are high enough to not attend school in person.
The decision to return to in-person learning was based on metrics by County Health, and we are now in the red for 2 of those 3 metrics. So we never would have gone back into buildings if these were the numbers we're seeing. We're seeing really high numbers of community spread. We're seeing cases on campuses, and this is we're meeting those benchmarks to not be in the building right now.
In the letter sent by the MEA, they state we should not wait until the metrics move to 3 red categories to plan and prepare to return to remote learning. This is our something now that we can do. Kelly Berg, the vice president of MAE, feels there may be consequences if the superintendent does not move classes to virtual learning.
I would anticipate that a lot of teachers will start organizing around sick outs. Campus specific. So once a campus can't cover the substitutes, then, if enough teachers call out sick and they can't get enough substitutes to cover those classes, they can't hold the class. So I would imagine that that's where this is heading.
Helen Hollins, the public information officer for the Mesa Unified School District, didn't say if the superintendent had come to a decision on moving the schools back to virtual learning, but she did say,
we make decisions on a school-by-school basis and at times a classroom-by-classroom basis.
She added that there's a variety of circumstances they look at, including the metrics, when considering the next step for the district. Currently, 4 neighboring districts have already transitioned to virtual learning due to coronavirus cases rising. Taylor Tasserotli, Cronkite News.
If the district were to move to virtual learning, this would affect 78 schools and around 63,000 students.
Right now, COVID-19 is affecting one of the most vulnerable populations, individuals with intellectual and developmental disabilities. Studies show people with IDDs are as much as 4 times more likely to die from the virus compared to others. Not only are they more susceptible to having health issues like diabetes, they have difficulties communicating to their healthcare providers when they aren't feeling well.
Instead of being able to tell you that their stomach's upset, they may simply become agitated every time they're around food because they can't verbally tell you that their stomach's upset, but they know that something causes them nausea maybe when they're around food, so they begin becoming agitated. And oftentimes these things are mistaken for just things that people with disabilities do, rather than recognizing that this might be a sign of some medical condition.
Solving this communication issue can mean life or death for many of these people. That's why Dr. Escude and his team are providing free training courses that teach physicians how to read the signs of COVID and other health issues in people with IDDs.
Masks have been shown to help slow the spread of the coronavirus, but how can the experience of wearing one be improved? Cronkite News reporter Tyler Mannion found out what one group of students has in mind to address that issue.
The Luminosity Lab at Arizona State University is a student-driven group that uses technology to solve complex problems for the people around them.
When COVID-19 first came about, we kind of stopped all the ongoing projects we were working on and realized that we needed to focus on COVID-19 relief efforts for our community.
After a few projects early in the pandemic, they have turned their attention toward improving the mask-wearing experience.
The flow mask.
Ducey says one of the biggest problems is hot air staying on the face or fogging up people's glasses, but they've solved that by creating distinct spaces for airflow.
By separating those 2 chambers and kind of allowing the air from your nose to dissipate below the mask and out to the sides, what happens is we're able to kind of reduce the amount of hot air that gets left on the face and improve that experience of wearing a mask for whoever's wearing it.
The Luminosity Lab entered their design in the $1 million X Prize Next Gen Mask Challenge and have been named a top 10 semifinalist. For Ducey, though, it's about something more than just winning a contest.
It means a lot that, we've gotten kind of this recognition and that people really enjoy this design. But for us, it's really, it doesn't stop here. It's all about trying to impact our community.
If you like what these students have come up with, you can vote for the Flow Mask at xprize.org/mask survey. Tyler Mannion, Cronkite News.
As for the presidential election, the Arizona Republican Party won a small victory in court yesterday by convincing a judge to allow them to inspect 2,500 ballots for irregularities. The party showed that 2 ballots out of 100 that were previously inspected resulted in deleted votes for President Donald Trump. In total, the issue at hand relates to 28,000 duplicate ballots which were reproduced by election workers due to originals returning damaged or not working in the tabulation machines. However, an attorney arguing against the inspection says even if 2% of all the ballots do have errors, it wouldn't come close to impacting the election results.
Prop 207 received a yes from Arizona voters to legalize marijuana, but what does this actually mean? Reporter Stephanie Rosales shares with us when you can start to buy, use, and possess weed in the Grand Canyon State.
Arizona voters chose to approve the use of recreational marijuana through Proposition 207. Now that the election results have been certified, the law can officially go into effect, meaning those who are over the age of 21 are allowed to possess up to 1 ounce of marijuana and grow up to 6 plants at their residence. But as a recreational user, you are not allowed to make purchases at dispensaries just yet.
You have to wait for that licensing to come through. We're expecting it to be March 2021 to be able to purchase cannabis as an adult user.
All dispensaries throughout Arizona are currently only for medical patients and will take some months to be certified as recreational dispensaries. Under the law, you are also not allowed to sell marijuana without a license or smoke it in public.
As far as public consumption goes, smoking it in public is going to be prohibited. However, being under the influence in public, so long as you're not behind the wheel of a car, probably is not going to be prosecutable.
The process to purchase pot as a recreational user should be simple.
Walk in, give us your state ID. We verify in the state system that you are above 21 years old, and then we go ahead and process a purchase for you at no exceeding that 1 ounce limit.
There are differences between medical and recreational users. There are purchase limits as well as limits on the amount of THC per day depending on your use. As recreational adult users, Prop 207 allows you to purchase up to 100 milligrams, just like these edibles, whereas medical patients don't have that limit and can even purchase up to 300 milligrams or more.
Nonetheless, you're not getting as high of doses as potent product, so potency meaning high THC or cannabinoid content. Rec users cannot pass that threshold.
Prop 207 might also be helpful for those who have been convicted of marijuana charges.
Or something that would now be legal, possessing or transporting, consuming up to 1 ounce of marijuana. If you have that conviction on your record, you are now eligible to have that expunged.
Stephanie Rosales, Cronkite News.
Not all dispensaries will be able to make the transition to recreational due to the social equity ownership program through Prop 207. This all depends on the population and communities who need it the most. Cronkite News will be right back after this short break.
As journalists at Cronkite News, we report on stories that matter to you by focusing on the local impact. We dig deeper and work tirelessly to keep you informed.
Live in Wickerburg.
Live in Los Angeles. In Cleveland. In Washington. In Louisville.
From Jerusalem.
Live in Philadelphia. From around the world to right here in Phoenix.
At Cronkite News, we report the facts and stick to the truth.
A recent study from USC Annenberg's Mesa Impact Project finds immigration is overcriminalized on television. One advocacy group is working with the entertainment industry to change the immigrant narrative. Cronkite News reporter Kylie Cochran shows us how they hope to move audiences into action.
How do you define American?
My parents and I came through the Arizona desert. I am a first-generation Mexican American, and I am very proud of my cultural background.
To be an American, it means that you come from diverse backgrounds.
3 faces, 3 different stories. These are the types of authentic stories the advocacy group Define American helps the entertainment industry tell about immigration.
At its core, Define American is working to create a narrative shift.
Elizabeth Voorhees is the Chief Strategy Officer at Define American.
And that narrative shift will ultimately create a change in perception and behavior, which can lead to the way that folks interact with immigrants in their communities.
That shift starts at the center of popular culture, television and film writing rooms, where Luis, Ulysses, and Bianca's stories are told.
Bringing in immigrants, undocumented immigrants, to the writers' rooms to help inform those stories and make sure that they're accurate and authentic.
Sarah Lowe is the Director of Research at Define American.
We then do a feedback loop with the research and see how that television season then played out in terms of the representation.
Define American has consulted on over 50 film and television projects. So just sit back,
Turn on your TV, and they may have consulted on one of your favorite binge-worthy TV shows, like Orange is the New Black or Superstore, your favorite network, like ABC or NBC, or even your favorite streaming channel, like Hulu and Netflix.
Our approach at Define American really is grounded in research. So we've been doing research with the Norman Lear Center at USC.
We analyzed all immigrant characters across the 2018 to 2019 TV season. And we also studied the impact of 3 major storylines from the 2018 to 2019 season that had nuanced depictions of immigrants and immigration on Madam Secretary, Orange is the New Black, and Superstore.
Compared to 2018, they found a 12% drop in the depiction of immigrant characters and crime, but it's not comparable to real-world numbers.
I mean, when much of what we see on TV is portraying immigrants as criminals, it really becomes a lot easier for people to believe false claims and divisive rhetoric.
The report did find that rhetoric can change when audiences are exposed to in-depth immigrant storylines on Madam Secretary or with Superstore's undocumented character Mateo.
Among the Superstore viewers that had no real-life contact with immigrants, these feelings of friendship with Mateo were associated with support for less stringent immigration policies.
Define American actually consulted on Superstore for 4 years. After watching, audiences reported taking action around immigration issues by volunteering, talking with family, marching, or donating.
Being able to look at the type of impact that it's having and hope for the future that building more of these characters and helping writers' rooms write characters that are really fully realized and that are really human and allowed to be human.
Kylie Cochran, Cronkite News.
Finally tonight, if you need anything to look forward to before the end of 2020, here's something interesting. The 2 largest planets in our solar system are getting closer than they've ever been since the Middle Ages. On the night of December 21st, which is the winter solstice, Jupiter and Saturn will appear closely aligned in the sky that they'll look like a double planet, forming what is known as the Christmas star. It's actually called a conjunction, and this one will be exceptionally rare. To see the Jupiter-Saturn conjunction, look low in the western sky for about an hour after sunset each evening between December 16th and Christmas. That's it for Cronkite News. Thanks for joining us.
For top Arizona stories anytime, go to cronkitenews.azpbs.org.